the best part of the talk was that how you made this whole complicated topic so simplified and which can be understood by every layman with your
Yeah.
expressions and with your animations, with your jargons and whatever the diagrams, etc. It was a
Thank
really
you.
wonderful deliberation on a very common problem, lower unit tract infections in females. So I can see in the question and answer box, there are three questions. So I will just first go to these questions and then I will have some comments from my side. So
Okay.
the question one is from Valamento is UTI dangerous? So any
Is
comments
UTI
on that?
dangerous?
Is
Is
UTI
UTI,
dangerous? Yeah.
is UTI dangerous?
Yes, yes.
Yes, UTI dangerous. Because first of all, it depends upon the virulence of the bacteria. If by chance you happen to get stuck by a very powerful bacteria, you may have a serious infection. That also depends upon your local condition of urinary tract. If in urinary tract there is a reason for the bacteria to stagnate, stay, multiply, enjoy, rejoice, then you can get serious nasty infection. And finally, if your body is having weakened defenses like diabetes or some problem with your immunity, same infection can become really very significant, and you can go into a state what we medically call as urosepsis. And once you have urosepsis, you can be really very sick. So we as urologists take every attack of UTI as potentially dangerous. That is why we are talking to prevent the infection in you.
So when this uncomplicated gets complicated due to some anatomical or functional abnormalities or the reduced immunity of the host or the increased virulence, or if it gets above into the kidneys, resulting in upper urinary tract infection, which can produce sepsis and septicemia sometimes can create havoc in these patients. So the next question was from Aarti. Uh, she is asking recurrent urinary tract infection in diabetics and with itching genitalia. So, what, any comments on that?
See, there are two issues. One issue is what is called external genitalia infection. And in diabetics, if their sugar level are high or as such, even if diabetes is controlled, they are they have poor defenses. So in the external genitalia, number of pathogenic organisms can multiply. They need not be only bacteria, they can be fungus, they can be other pathogens, and then they give rise to external genitalia itching. This will happen to you irrespective of urination. While sitting, while walking, while driving a car, there is itching in genitalia. But if you get itching only during passing urine, then this is a part of the urinary infection. This means that the bacterial growth has gone inwards into urethra and giving you the problem. So you as a person, you should know this differentiation, and as a doctor we also know this differentiation. External genitalia can be treated very easily by topical application of antibiotic washes or antibiotic creams, antifungal creams, and of course you need a very good control of your diabetes, right? So external genital infection in my view is a precursor of internal urinary infection.
Right. So probably often this fungal infection of vagina and the vulva will be confused with the symptoms of urinary tract infection. So if the patient has only itching, maybe throughout, it could be a vaginal infection, fungal infection. That also should be looked
Yes,
into. I'm sure.
yes.
The third question
And
was
if
from
if
James.
if
Yes.
if the itching is associated with excessive vaginal discharge, then you should worry about it. Of course, definitely.
Right. So then you need to get a vaginal swab culture, also fungal for
Yes,
fungal infection, and get
and get
treated.
yourself examined by gynecology colleague and get it treated well.
All right. Another question was from James, who is asking if you want to take the perineal care, is vinegar mixed with water could be a good thing for care of perineum?
Uh, See, all said and done, application of first of all, you will not have control on the concentration of vinegar mixed with the liquid. Sometimes it can be diluted, some kinds can be stronger, and the chemical can create local reaction. Genital skin is very delicate, very vital, and very supple. So you cannot ask XYZ to use a diluted vinegar mixed in water and wash the perineum. Because you do not know how much of vinegar they will use, how much of water they will use, and for how long they will apply it. So the safety part of this kind of fluid, this kind of recommendation is not very strong to my mind. So I don't think you need to do. If you can use simple water to wash the genitalia, or if you can use simple soap and water to wash the genitalia, you can use pre-medicated wipes to wash the genitalia. They are more controlled things, and they are tested on human beings for their safety, and then only they are marketed and you are asked to use them. Better to
Right.
avoid indigenous systems.
Right. Because we consider vulva to be a very sensitive skin area. It is as sensitive as your lips. So it is
Yes,
very important that you do not overtreat these, or do something over enthusiastically in that area, which may result in some kind of allergic reaction and inflammation, and which can
yes,
cause more infection rather than improve.
yeah, yes,
So, because many women are in habit of using vaginal douching, using
yes,
deodorants, various type of allergic soaps and other materials, which cause more harm than probably doing good to this area, particularly which is so sensitive. So, I think
yes.
it is very important that you need to take care of vulva and take it very in a way that it doesn't damage the vulval skin, which is so sensitive. There is a question that is OM9 available in India?
Yeah, for a while it was made available by a company that time called Envexi, by a name Eurovexom, and this is about I think 5-6 years ago. But then it came for a few months and a few 6 months, 8 months, and it withdrawn for some reason. So it is not freely available in India, and I do not know what is the company's outlook at nowadays. But it is available. I'm aware of its availability in Europe, and I don't know about United States, but it is available, and people are prescribing it, and patients are using it.
Okay.
It is marketed in the name of Eurovexom.
Yeah, Eurovexom, which is more,
Eurovexom.
I
Yes.
think people know it by Eurovexom more than OM9. And, another question is that treating asymptomatic bacteriuria by different antibiotics by different physicians and gynecologists, ultimately leading to antimicrobial resistance. I think this is a very, very important topic because we are seeing a lot of antimicrobial resistance. Unless we judiciously and use antibiotics, it is going to create havoc in near future. So I think this is a very important aspect in treating these infections, and we did not treat probably asymptomatic bacteriuria every time with antibiotics. Your comments on this?
First of all, see, you must diagnose this entity very well. Asymptomatic bacteriuria. You need, it is just not one urine sample report that you see some bacterial population and you start treating it. The same bacteria has to be documented in urine culture done more than twice at a gap of 24 hours, 36 hours. And if that happens, then you qualify that the patient is suffering from asymptomatic bacteriuria. That's one. Second thing is, don't jump on and start treating this entity immediately in everybody. There are only very select individuals where you have to treat asymptomatic bacteriuria. Otherwise, don't worry about it. They are just there in urine. They are not going to be harmful. There are enough evidences to say that asymptomatic bacteriuria is not a bad thing to have, except, except, except in somebody who has uncontrolled diabetes, except in somebody who is renal transplant recipient, is immunocompromised, somebody who has had radiation therapy on the pelvis, right? So there are reasons for one to be immunocompromised, and then only in pregnancy sometimes we treat asymptomatic bacteriuria, because if in pregnancy infection occurs, the lady will have to pay a very heavy price, and not by lady but by the baby also. So there we treat asymptomatic bacteriuria. Otherwise, for general population, just because patient has come and sit in front of you showing a report of positive culture doesn't make sense. So don't treat.
All right. So asymptomatic, and even if there are very mild symptoms, probably these can be taken care of by certain behavioral changes, behavioral therapy, and certain changes in the fluids and diet,
Yes.
taking a lot of fluids and changing the dietary habits, avoiding spicy food and other things may reduce the symptoms in these patients. And I think
True.
there's a role of some herbal medicines also. We have some herbal medicine in India, and I have an experience that these are quite good in patients who have mild symptoms. So before
True.
just embarking on antibiotics for mild infections, I think we should actually take care of these by different other methods. Uh, Another question was on phosphomycin use of, because this is again another antibiotic which could be used for prophylactic chemoprophylaxis. So what is your comment on phosphomycin?
See, phosphomycin is a very powerful drug to treat cystitis in women. In fact, it's a drug of choice for treating uncomplicated cystitis. But for trying to use this for prevention of infection, we'll be losing a potent tool, because then you can generate resistance in the bacteria. So as a community practice, as a general guideline practice, we don't recommend using phosphomycin for prevention of infection in everybody. But then there are certain exceptions, right? The certain exceptions, like people who have neurogenic bladder, where when they get bad infection and they become really sick. And as I said, those who are immunocompromised and they cannot take other antibiotics systemically, orally. So there are some reason when you can use this for prophylaxis. There are people who do clean intermittent catheterization, and when they do catheterization after 10 11 times they get infection. So they come back and tell you, sir, you asked me to do clean intermittent catheterization, I used it for 1 month and I had 3 attacks of infection. They use all precautions, but even then they get infection. So then these become the reasons where you can use phosphomycin for prevention of urinary infection. Otherwise, my request to you is not to use this drug left and right, because this is a tool which you will use to eliminate infection when patient is having symptomatic cystitis.
All right. So phosphomycin is something which should be reserved for probably a recurrent urinary tract infection, or
Yes,
sometimes when there is antibacterial resistance and you find that the common drugs are not effective or resistant
yes,
to infection,
yes,
then definitely we have phosphomycin, which is usually sensitive to these organisms. Right.
yes.
So now I will just have a few comments from my side and queries. Uh, I often wonder in these urinary tract infection patients why it is so common in some areas and particularly in countries like ours. Um, I feel that one of the cause for urinary tract infection in women is that we do not have a good infrastructure of public toilets in outdoors as it is there in the West. We do not have women who can go to loo or pee in the outdoors, particularly when they are working women or when they are going on vacations. You do not find good toilets where they can actually urinate. And this results in deferring urination uh, for women in our country. And this probably, in a chronic habit, results in functional voiding dysfunction. And this voiding dysfunction probably can result in urinary tract infections and recurrence of urinary tract infections. So, what
Quite
is your
true.
take? Yeah.
Quite true. Quite true. I fully agree to what you're saying. And I also add to this, in school girls, young girls, when they go to school and they're not good toilets in schools for young girls, they also have similar problem. In fact, mothers in India train their daughters, when they go out of the house, empty the bladder, because when you come back to the house, then only you should empty your bladder. Otherwise, you develop a talent, a skill to keep urine in the bladder. You will not get access to toilet outside. Now, this is the kind of training which is imparted from mother to the daughter, and that is the reason adolescents get urinary infection.
All right. So, this voiding function, the functional
This voiding
disvoid
function. This is called acquired faulty habits.
habits. Right, right. Another thing which I often have pondered on, and I think is not being discussed and neglected because of the topic being a very embarrassing topic, or maybe people feel shy of discussing this. I feel that the role of undergarments is very important in urinary tract infection, particularly its recurrence. And then I just went through the literature and I could find that the undergarments, because often we do not take care of these undergarments. Often they are made of synthetic material. Often they are not properly fitting. They're very tight fitting or ill fitting garments. And they often would produce a kind of a thing which is called chafing, which is causing friction. Because of the friction with the sensitive skin of the vulva, it produces a reaction, inflammatory reaction, and then it causes inflammation. And then many of these panties will have panty liners, which again cause irritation of that region, and that gives rise to more infection. And what we see that most of these undergarments are not properly taken care of. They are not washed properly. And sometimes they need to be disposed of after a few uses or maybe after a few weeks use, and that is usually not done. And what happens that they gather some type of bacterial infection in that, though it appears to be clean, but studies have shown that even these clean undergarments have 83% bacteria. 83% of these so-called clean undergarments have bacteria, which is, and often they have some soiling from the feces also, which usually are not apparent on naked eye. And so because of the menstrual blood or the urine or sometimes feces, they often get collected there, and after cleaning also they do not get, and they have a chronic source of bacterial infection. So I think we should work on this aspect also, because a constant use of this type of undergarments, because we are not in habit of using undergarments 24 hours. And so this could also be a kind of source of infection. And there is a kind of something I feel that there should be research. There are communities which are not in habit of wearing undergarments. And
Yeah,
do
quite true.
these communities have less of recurrent urinary tract infection is again an area of research, I think, because most of these, so probably what is probably is needed is that we need to use undergarments made of proper material, absorbent material, particularly cotton. It should be properly fitting. Uh, and if we can have certain time, like when you go to bed, if you can go without undergarments, then it could at least be that area, because most of these areas, because it become conducive to bacterial growth because of the warm and humid climate that this undergarments produce. So I feel that this is a very important aspect which should be dealt with in recurrent urinary tract infection. Any comments from your side?
I fully agree to what you're saying. The points that you raised, they're very, very relevant. And in an individual case, they can really become an important factor. Very, very important factor. So I fully agree with what you're saying, 200%.
And I think
And
this
also,
should be.
one more thing which happens is that when somebody uses a very tight undergarment, particularly young girls and ladies, and if they also happen to be obese, then the tight fitting undergarment leads to what? It leads to a tighter approximation of labia majora to each other. So it becomes like closed surface from outside. And inside the labial closure area, inside is the vestibule. And in the vestibule, there's a lot of warmth. So you get a closed room kind of effect where bacteria can multiply because there's a warmth, there's a moisture, there's a nutrition. So these tight fittings, synthetic undergarments in obese ladies, as I think is going to be more harmful. So they should use, as you rightly said, undergarments is made of cotton, which is ventilated, which does not give warmth and all those things in that area.
Right. Yeah. So particularly because the ladies, young ladies, are in habit of wearing tight jeans and tight undergarments, etc. And as I said, it creates a problem called chafing, which is friction of the inner thighs or the vulva, all results in chronic irritation and cause some reaction on the skin,
True,
which is prone
true,
to infection.
true,
That's right.
true.
That's right. And one more thing that probably is important here is many times these infections are due to sexual activity. And sometimes the partner is also infected. So we need to take a proper history in these patients of a partner, uh, whether his genitalia is infected, he has a preputial infection. And in these cases, definitely we need to treat both the partners in the beginning only. Otherwise, it
Yes.
leads to a vicious cycle, which one gets better, then the other again gives rise to infection, and then the so.
True.
Any comment on that? Yes.
Yes. Actually, when male gets infected, they can pick it very quickly if it is an external genitalia infection, and because it's a painful situation to them. But yes, it depends upon the intelligence of the person or the social status of the person, the male particularly, that can he spot out his external genitalia infection. If that is the case, and I insist them to use a barrier thing, and use of a proper medicated condom is a good thing to be a way to prevent occurrence of infection from male to female and from female to male.
Right.
So you rightly said, both partners should be treated simultaneously, and they should be advised to either abstain sexually. If they cannot abstain sexually, use a barrier, a condom.
At least then let them get treated for that
Yes,
infection,
yes,
and then
yes,
things
yes,
start.
yes,
Yes.
yes.
Another aspect I was thinking that which is very close to my heart is the human microbiome. And we know that as there is a gut microbiome which is almost to the weight of 2 kgs, and which has a genome which is 150 times more than the human genome. So I
Mm,
think this is probably something which is going to change the future of medicine. Similarly, as gut microbiome, we have a urinary microbiome. And
true.
in urinary microbiome, the dogma that urine and the bladder and urethra is sterile is no more holds good, because the
Yes.
conventional culture doesn't pick up these organisms. So if we have the enhanced culture or the next generation sequencing of DNA, which has
Mm,
shown us that these are filled up with different microorganisms, and this is
mm,
usually a normal bacterial flora. And if it gets disoriented, or there is a condition called dysbiosis, where it results in different type of problems in bladder. It could give
quite true.
rise to cystitis, it can give rise to urinary tract infection, and so many other problems. So the normal urinary microbiome is a very good defense mechanism to prevent uh, the pathogenic organisms to grow. So I think this is an important research area where we should look into to prevent urinary tract infection, how to maintain this urinary microbiome and not let the pathogenic microorganism grow.
Quite
Any
true.
comment?
See, that's the precise reason we are against the improper use of antibiotic therapy. And that's the precise reason that the guidelines state with this condition, use this drug. With this much of infection, use this much of duration of therapy. Because the risk with treatment of infection in ladies is that you advise them a 5-day therapy, they take it for longer duration. And then they can also self treat themselves. That is also another problem which happens in our country. You give them a prescription for one episode, the patient will retain the prescription, and whenever they get even minor symptom, they reuse the same prescription in India. And this gives rise to, killing the urinary microbiome that you are referring to. And the kind of balance, healthy bacteria and a dangerous bacteria, the kind of local defense is weakened. So I fully agreed. I'm sure something will definitely come up in future on the population of bacteria which are commensals in urine, like oral cavity, nasal cavity, vaginal cavity, urinary bladder is also cavity. So there has to be a microbiome in this cavity. And you see, over and above the microbiome, people are also looking at, as I showed you, some antimicrobial peptides which are normal in that area. You have a lot of peptides in nasal mucosa which protect you from recurrence of infection in nose, oral mucosa. In the same way, you have a mucosa of the urinary bladder also, which is as sensitive, as immunoresponsive, as immunoreactive as nose. So all these areas are future areas to be explored, and I hope something will definitely emerge there also.
Right, you rightly said. And antibiotics today is a double-edged sword, as I think. because it can cause problems also, and it can benefit also patients. And the way the antibiotics are being used injudiciously, and overuse of antibiotics and improper use, and I think we need to have a debate on it, whether it is actually benefiting or
Yeah,
harming society.
true, true, true.
So, because the
I don't know.
antimicrobial resistance is going to be a big problem in the near future, and we may
Yes,
not have even antibiotics for very simple infections like ear infections and UTI, etc. And we may be landing into big sepsis because these antibiotics are not effective. Uh, anyway, thank you very much. And
thank you
I
very
would
much.
now request Dr. Mahendra Bhandari, who is again with us, to have his comments. Dr. Mahendra Bhandari, would you please come in, sir?
Thank you very much, Divakar. And what a great, not that I'm surprised, I have been visiting your university site, educational institution. What animations, and that's what I was looking for, patient education. Because it's a partnership, as you say, a patient. Number one, you are great urologist of current times in India. And let me remember me that there are two conditions which needs more attention. One is chronic prostatitis and urinary tract infection in female. Because if you take the cumulative morbidity, even the cancer, stones, the patients, they suffer longitudinally. I have still the females, they chase me, which I have followed them for 40 years, do nothing, talk to them, adjust them, and tell them don't bother about the urine culture. So I think this area needs more attention from the point of view. I would re-emphasize few points which my memory raked in. Number one, I'll give tribute to my teacher, Professor H.S. Bhatt. You know him.
Yes, yes.
And he used to tell two things which your talks have revalidated for me. One thing, whenever I will write a prescription as a resident for urine culture of a female, and that I was totally new. I thought every bacteria needs to be treated. And he'll say, oh, why have you written this? Septran was a new drug in those days. So I said that culture shows some citrobacter or some stupid organism. He said, he used to laugh and say, send it again, it will grow even tigers because it's a female urine. And that message resonates even to me. And it's very hard to tell patients because these days the culture in India is before coming to urology, they'll go and get a culture done as if culture is a treatment for them. So that point I like to. Second thing, what you talked, Divakar mentioned about the voiding habits of the female. It's a God-given gift to them. They can hold urine for any number of times because they don't have the facility, which you really emphasize. I'll quote an instance, and I'm not exaggerating. There are patients I remember. In 79, in All India Institute, I had a patient referred from Calcutta as a tumor. 70-year-old lady with the whole belly full of a smooth mass in the urethra. I didn't know what the hell I'm dealing with. And there was no ultrasound in those days, Shivam.
Yeah.
And we thought we will see that. And I did all what I don't remember. And it was a urinary bladder. Taking the history, believe me, this lady used to pass the urine once in 7 days for years together. Absolutely normal upper tracts. And 6 liters of urine we drained for the first time. Now, how do we looked into all kind of things, whether it's a kind of a bladder myopathy or whatever it is. You wouldn't get such outliers, but the point is very important that frequent voiding helps them. Another point which needs to be emphasized is most of the symptoms of urinary tract which bothers these women are burning, irritation. It comes into normal course of the life. Some guest is coming and the lady's running between bathroom and home. It's embarrassing. Hydration is one thing. because people will write pyridium, which would do nothing except for staining their undergarments. I believed in hydration a lot. And I would say that I think, I know now because I refer a lot of patients to my colleagues and friends in India. And anybody who wants to deal with two conditions have to be a patient urologist who should listen to the patient, try and understand, because most of the answers are given when you have talked to the patient that how did the infection begin? Was it in sexual intercourse or not? I remember having attended, you talked about the prevention of urinary tract infection in the productive sexual health by treating them pre-intercourse if they can have a medicine. There used to be vaginal tablets they used to advise. Go and look up, there used to be a Professor Fau from Jerusalem. And Professor Fau is known for urine. He did I happened to see him in a conference in Tel Aviv, and I had not known, but he was an authority in those days on urinary tract infection. And he fought for hours. And the argument was that how can one preempt that one is going to have a sexual intercourse, and how can you put preemptively? And he argued. So I think that is a very important point. And the point is hygiene, which you emphasize. And I won't agree with you more that don't use any chemicals or anything. Use plain running water, but patient water so that mechanically you can wash these bacteria. So I think only one point I would like to, as a question I would like to ask, which is in fact a summary, Divakar, you already said, both of you said. We are talking of grades of urinary tract infection, beginning from some outliers. I have seen people dying of urosepsis. You take lightly and suddenly they go into hypovolemia, shock, and they die of urine. Very few of them. That kind of symptomatic infection to this noisy symptomatic infection, which keeps on bothering them in and off and on. Then you have a phase of abacteriuria because you have treated them. And then there is a recurrence. And you explained beautifully the reservoir cells in the bladder and the immune complexes where the bacteria don't go anywhere. So what I would like you to tell once again, at the cost of repetition, is that this point is to be drilled again and again, that bacterial culture needs an interpretation beyond the patient himself, and never get involved or concerned about something coming. It happens that when there is a culture, then they start thinking that, oh, I have problem or symptoms also. So I think wonderful webinar, a lot of for me to digest and carry home. You refresh my knowledge with the Euro vaccines and so many new information. Thank you very much, and I hand you over back to Shivam.
Thank you, sir. So there's a question from Korean George that what is the role of cranberry juice in prevention?
Yes. The cranberry juice and cranberry products came as a big bang about 10 years ago. And there are lots of publications which said that if you take so much of cranberry juice, if you take so many of cranberry tablets, your recurrence of infection will go down. And I'm myself aware of reading so many papers on this, and I was keynote speaker on use of cranberry juice and how cranberry can prevent the adhesion of the bacteria to the lining of the urinary bladder. But then, after that, many randomized trials were done in all age group of patients, both men and women, boys and girls, elderly ladies, different high-risk group of patients who get urinary infection. Finally, there's Cochrane analysis 4 years ago, which said that a use of cranberry juice is not an effective way to prevent recurrent urinary infection. So the curtain has been put on the use of cranberry. And today, the guidelines, the EAU guidelines recommend that cranberry juice is not a good way to prevent urinary infection. But all said and done, for an individual patient, these are statistical data. In thousands of cases, in only 5% patient, infection could be prevented. So it is not statistically significant, right? So these papers, analysis, meta-analysis, and reviews are, at the end of it, are statistical data. How will an individual patient behave is a different matter. So if you are getting recurrence of infection, and if you as an individual respond to cranberry juice, go ahead and take it. There's no problem in it. At least it is not going to harm you. So for individuals, it can be useful, but as a group, as a guideline, as an organization, it is not recommended for use.
Shivam, I'll butt in here because I have a publication on cranberry juice.
Okay, sir.
In my papers on magnetic resonance spectroscopy we use for urinary tract infection identification of bacteria, there are about half a dozen papers, and we had one PhD, Ashish, who did that. So I agree with Divakar that I was fond of cranberry juice as a substitute. I saw that monumental paper which came in NEJM or JAMA, which said that it doesn't work. Very convincing story. Our contribution to this was that we gave a mechanism of how it works. When the cranberry juice was introduced, it was told that it is acid. And it would act because of it acidifies urine and kills the bacteria. But truth is what he said, that I'm forgetting that there is a component within the bacteria which gives a substrate competition with E. coli. And it doesn't let the bacteria adhere to the wall. And again, the same thing Dr. Bhatt used to say, that even if I put fecal matter with the cystoscope in females, I cannot create infection. I can create a contamination. For creating an infection, you need to have a soil and seed theory, what Divakar said. So if the immune complexes are good, if you don't traumatize the bladder, we cause contamination all the time, which the body defenses will take care of it. So cranberry juice, I would say, that keeps them busy, and it's available in India. And sure, the evidence is against, but I don't practice medicine purely with evidence because, as Divakar said, it's an art, and what works for a patient needs to be decided. So, thank you.
Sir, rightly said. It's not just the level of evidence, but your experience also matters. And what probably the component Dr. Mahendra Bhandari was referring to is probably the proanthocyanidin, which is probably the product which results in vaginal colonization, and that helps in preventing infection. There is one question from what are the symptoms of UTI? As rightly said by Dr. Dalela, that frequency, urgency, dysuria, burning micturition, and even difficulty in voiding, sometimes straining, could be the cause of symptoms for urinary tract infection. There's a question from Valmonte, is it necessary to use feminine wash? Where there is a lot of wash available in the market, lactic acid wash and all those wash available. Does it really help?
See, I'm aware of lots of washes which are available for genitalia wash. They give you nice odor. They give you a good feel when you apply it. But my feeling is they are just giving you a mechanism, an opportunity to wash the genitalia. That's it. If you can wash the genitalia with simple water, you will get probably similar effect. But when you start applying so many fancy things, you probably get an added reason to go ahead and do it. It's just like asking you to wash your face. You can wash your face with plain water, that's fine. But you can apply all kind of gels, creams, and soaps and water, and you can wash and get lots of good feel on your face. But whether they actually make you look better, whether they make you actually look more fairer, is a big question. So similarly, these lactobacillus washes, lactobacillus gels, they are usually made commercially available. They are sold, but will they actually benefit you, prevent some infection? I don't know. Again, it is a data which says that they are not very effective in prevention of infection. But as I said, individual patients have different responses. If you want to try on you and if you get better, I would only recommend that don't go on using them excessively. If you use them excessively, then you can invite infection by resistant organisms, not bacteria but by fungus, right? Or by some other bacteria. And definitely it's going to affect the microbiome of the vagina and the microbiome of the urinary bladder. So if you're not getting infection too often, don't play with the nature. Human body is a self-cleansing, self-healing system.
Right.
Give time, have faith, have patience. Just take plenty of water, just wash your genitalia with simple water. Believe in Mother Nature, you'll be fine.
All right. I think my take is that particularly in postmenopausal women, where the vaginal epithelium gets atrophied and there is a reduction in the lactoacid bacillus and lactobacillus, and it becomes more alkaline, which is not conducive, and it is more conducive for infection. So there probably this might work, the lactic acid making acidic environment and preventing urinary tract infection. So particularly those subset of patients may be helped by these washes, I think. Another question is, can there be UTI?
Just one thing.
Yes,
Just,
please.
I'm aware of lots of vaginal vaccines which have been developed to prevent recurrence of infection. I'm aware of various lactobacillus capsules and formulations which are applied inside the vagina to improve the population of healthy bacteria inside the vagina, so that they can offer a competition to pathogenic bacteria, and this way a population of harmful bacteria is reduced. On a similar pretext, these genitalia washes have been evolved. Now, what will the genitalia wash do? It will only do an external wash. What you need is intravaginal change, which is difficult to create by these topical washes. So if at all you have to treat vaginal flora, and if at all you wish to change the vaginal flora to a healthy flora, you may adopt one of those practices, lactobacillus gel or lactobacillus capsules. Now, there have been trials in different strains of lactobacilli. There are about 8-9 strains, serotypes of lactobacilli. Not every lactobacillus is useful and effective. There are only 2 which have been found useful and effective. But again, it's a research area. They are recommended only within the investigational trials. They have so far not been open to public use.
All right, sir. Another question is from Vandana Singh. Can there be urinary tract infection during periods? Please unmute yourself, Dr. Dalil.
Yes, if somebody is using not a clean sanitary napkin, in India, you know, there are various reasons for people not to use a sanitary pad, proper pad, and if they're already having a vaginal infection, untreated vaginal infection, and they have periods, then they pour out very foul smelling and bad vaginal discharge. And if you don't use nice sanitary pad, then you run a risk of catching urinary infection. Of course it is. You know, it is for the same reason in our Indian practice, it used to be abstain sexually during menstrual period. Because if you involve in sexual activity in menstrual period, if vaginal secretions are not healthy, you run a risk of introducing them in the urethra and urinary bladder and giving rise to a bad urinary infection. So your point is right, this can happen.
All right. Another question is using panty liner with negative ion is safe and can treat UTI? I think I don't have any idea that panty liners with negative ion is more of a marketing gimmick, I think.
Yes, true.
The people do. I think panty liners produce more harm than doing good because of the irritation that they can produce and cause a vulval irritation and itching. So another
See,
question is about any name. Yes, please.
see,
Have you any
okay,
comments, Dalil? Please unmute yourself. Unmute. Dr. Dalila, you're muted.
yeah. The panty liner issue is when something comes on panty liner, and if it is charged, it can potentially treat that thing, right? But how do you expect the charge from panty liner to go and move inwards and reach to the vulval epithelium and to reach to the vestibular epithelium and show the action? So it is recommended in those people who take long travel, air travel, and they keep sitting in their seat for a long time and they feel some kind of excoriating feeling in the genitalia because of the warmth and secretion, all those stuff. So there, if you have a panty liner, probably it will reduce that genitalia discomfort, right? Please understand the difference. It's a genitalia discomfort because of the clothes that you wear, the seat that you sit in, right? So here we're talking about preventing infection. So I fully agree with Dr. Shivam that maybe a marketing gimmick rather than being an effective way to prevent urinary infection.
Right. There's another question from Dr. Jaspreet that give the names of the herbal medicines. I don't know whether it would be appropriate to give the names of herbal medicines, but
Yeah,
there
true.
are many available. If you go online, you would be able to know there are few herbal medicines, and they probably do not do much harm, and they can help in some milder infection or symptoms. Anything you want to say on those?
I think herbal medicines by and large work by making a urine alkaline. And if you are having too much of dysuria, too much of burning sensation, then herbal medicines will your tame the urinary bladder down and your symptoms will be much lesser. Only few herbal preparations have antibacterial capability, right? And then they can work as Dr. Shivam said. Use them only for patients who have mild infection and only for those patients who will not develop serious consequence of urinary infection, like a compromised host, right? Don't give him herbal medicine for 10 days and she is already a compromised host and she comes back with nasty urosepsis. So use your clinical judgment when to give this and when not to give this.
All right. There's a question again from Aarti. She is asking, this is COVID time. So is there any relation of these post-COVID complications with urinary tract infection?
See, unless you are hospitalized because of COVID infection and you are in ICU in a high dependency unit and you see, I have been treating post-COVID UTI recently because the patients when they're admitted in COVID ward and COVID rooms, the toilet facilities are not good. The patient has to get up and walk and go to the toilet. Even in the ICU in COVID hospitals, they made only 2 toilets and 10 bedded ICU. So patient has to walk, and there are not enough staff in ICU and the rooms to offer you a bedpan. So what they're doing is they're catheterizing the patient. So the catheterization not needed here because patient cannot go walk because of fall in the saturation. Because of walking, the patient is catheterized. The patient cannot be given bedpan because there's shortage of staff in hospital and nurses and doctors they are catheterized. So as a result of this faulty planning and policy, the patients are getting urinary infection post-COVID. And I have had
Right.
my share of patients coming to me in my last after first COVID wave in India. There's a period for 3-4 months when we started working again. Then it's a lots of UTI patients because of they hospitalized there and they got infection. But whether the COVID makes you systemically prone to catch urinary infection, that remains to be seen. I'm aware of some fungal infections taking place in nose and lungs areas because of steroids. Same thing can happen in urinary tract. Because when you take steroids for a long time, your immunity level will go down, of course. And then you can get external genitalia itching, external genitalia infection, and sure enough, you can get low urinary tract infection also as a consequence of continued steroid usage. So be careful, watch out on the duration and dose of steroid therapy for post-COVID complications.
All right. Interestingly, previously they used to say that urine doesn't contain the coronavirus, And but later there were few studies which showed that
Yeah.
urine also has coronavirus. And as
Coronavirus.
urologists, we were quite scared because we were doing all those TURP surgeries and cystoscopies, etc. And interestingly, we have given one of our residents a study on urinary symptoms in patients who have COVID. It is not just a coincidental urinary symptoms because of all those problems as you stated, but per se COVID causing urinary symptoms. Is it there? So we are doing a survey and we might get some results maybe in coming few months. So that's quite interesting. Another question was from Vijay Lakshmi that you said about the soap for cleaning the vulva, which may cause sometimes a burning, and we need to take care about the THF, she is saying. So I think she is right in saying that over enthusiastic cleaning, like some of these soaps are very allergenic property. They can cause more harm rather than, and as Dr. Bhandari said, yeah, just simple water cleaning could be even a better option rather than using a lot of soap. Any comment on that? Yes.
Yes. See, X person may be allergic to one particular type of soap. The Y person may be allergic to another type of soap. So it's a very individualistic response to a particular type of soap or a liquid soap that you use. I know of many ladies who use hand washes for genitalia wash, and they say they're very happy with the same liquid soap solution, and it gives them a good, nice, clean feeling, and gives them probably some prevention of infection. I'm also aware of some ladies who use these hand wash gels for genitalia cleaning before they go to bed every day in the evening, and they feel that this is the way to prevent postcoital urinary infection. I'm aware of ladies who use these soaps to wash genitalia after sexual activity, and they are fine. So what I'm saying is there are many individualistically applicable ways which can be used to prevent infection. But then whether they are useful across the country, across the globe, across the ages of people, and then come up in Indian guidelines or international guidelines to be talked in a forum like here, that use this, your infection will go. So this has become a very tall claim from our side and from Shivam's side. That's why we are refraining our very small individualistic examples to tell you what will harm you and what will not harm you.
Right. There was one question from Rajkumar that what are the prophylactic antimicrobial treatment in chronic recurrent UTI? I think you could discuss this probably. Then there are nitrofurantoin and clotrimazole and sometimes even methenamine. All these may probably would be prophylactic antimicrobial treatment. Can a male person have UTI from James Miko? Yes, definitely. Though the prevalence is quite low, females do have a 10 times more chance of urinary tract infection, but males also, particularly elderly males who have obstructive voiding symptoms, etc., can do have urinary tract infection. Even young patients can have urinary tract infection if they have some obstructive problem, phimosis or preputial infection. Any take on that, Dr. Dalela? Male person with UTI.
You mean what? Male person getting infection from female?
He is asking whether can male have UTI. Definitely yes.
Why not? Why not? Yes. It's a separate topic. Topic. Males get more. See, elderly males get a lot of urinary infection. Sexually active males get a lot of urinary infection, but boys, younger age group, don't get too much of urinary infection. But of course, it's separate disease to talk. We cannot transfer the same thing here, same impressions here.
Another question from Jasprit, lactobacillus creams are available under which name? Again, we cannot probably name the names, but at least they are
Google.
available.
Do a Google, you will find them. Yeah.
Fine. How is public toilet related to UTI? Oh, definitely yes, because one was the lack of public toilets. So as I had said, that women usually defer voiding, which can result in functional disvoiding and etc., and can cause urinary tract infection. And probably the toilets are not hygienic, and they are not, so that again can cause urinary tract infection. Anything you want to say on that?
See, unless the lady gets a contact with the toilet seat. Suppose there's a toilet seat which is not, if it's too filthy, of course you will not use it. But if you think visibly it looks clean, but it is contaminated, and you pass urine in that toilet seat in a train journey or in an aeroplane journey or in some public toilet, and you fear that by visiting a particular toilet you will catch urinary infection. And I know of ladies who are so scared of getting infection by going into public toilet that they pass urine in almost in a reclined position. They just go close to toilet seat, they don't sit over it, and they pass urine and they come out. They don't want to maintain a contact with the seat. They're so paranoid with catching infection. So, what I want to say here is, until and unless you get a physical contact with the toilet seat, you will not air suck the infection in your genitalia. So what is recommended is, there are tissue papers, pre-medicated or sterile. They come in the shape of the commode seat covers. They are disposable wipes. They are available. You can put them there. You can put those covers there on the toilet seat, sit over it, pass urine, and then dispose that piece of tissue paper, seat cover kind of thing. So that you can use when you have to visit a toilet whose cleanliness is questionable. But otherwise, I think by and large, visiting a toilet just there and hoping that you will get infection, it looks to me quite a bit of far-fetched imagination.
It says the patient is suffering urinary tract infection for a long time, initially facing tract burning after blood falling, very often facing the problem. During problem, urine cultured and antibiotics were applied. She was visiting a doctor in Kolkata in 2018. This doctor advised lots of tests but did not find any remarkable problem. The doctor also advised CTKUB with urogram test and found mild diffuse thinking of urinary bladder while another study was normal. Doctor advanced to take Cranpac-D tab but not getting proper result. Please have your valuable advice. So that's a question that came via email.
This is a very specific clinical situation, because you had symptom, you had blood in urine, you undergone CT scan of the low urinary tract, and you're still not responding. You need to be investigated. So I don't think you should take opinion from us, just digital communication. You need to be physically examined by a urologist. You need to be seen more thoroughly. You need more tests to see what is the cause of your bleeding in your urine. Why are you not responding to medication? So don't take our advice here and treat yourself on the basis of that advice. I recommend you to visit a urologist again.
All right, exactly. Some of these acute UTI definitely can produce hematuria. So definitely those patients who have complicated UTI, hematuria, they should be probably further investigated, maybe with ultrasound or CT scan to exactly know the cause of these hematuria and UTI. So thank you very much. I think with this, we should wind up.
Yes.
And I thank again Dr. Divakar Dalela for that wonderful presentation and making this so simplified and so understandable to everybody. Thank you, Dave.
Thank you,
for
Dave.
Inviting us. And thank you, Mandari Saab. And
thank you,
Vattikuti
Gentlemen,
and I must thank all listeners to be patiently sitting across with us for 1 hour and listening to this thing. Thank you very much. Thank you, everybody.
A very insightful program today. Thank you so much.
Thank you.
It was really interesting. I learned a lot just, enjoying this presentation very much. So
thank you very much. Thank you very much. Thank you, Dr. Shivam. Thanks very much.
Thank you very much. Thank you, Dave. And a good day to everybody.
Bye-bye.
Bye-bye.